October is Breast Cancer Month, and this is the time where we feel we should highlight some of the issues, challenges that the people that have been diagnosed with such a disease get to know the kind of information that they're supposed to know, and also to discuss with some of the people that are going through chemotherapy, because as we know, cancer is now the #1 killer disease. But we want to know why. Is it lack of knowledge? Is it lack of information? Is it expensive for one to be cured? So we are joined by Dr. Nyakabau to unravel some of these issues that we have highlighted from the beginning. Dr. Nyakabau, how are you?
Oh, thank you very much. I'm very well. I'm excited during this October month. Yes, we talk about highlighting breast cancer awareness, but actually we should be talking about all cancers throughout the year. This is just a focus simply because there's so many cancers and we want to be focusing on different cancers on different months in the year.
So, what is the challenge that at the end of the day, so much noise is made during October, but not from January to this month?
Okay, it's just there is International Union Against Cancer, which has come up with the cancer calendar. For different months, we actually focus on different cancers so that we can sort of like then go deeper on individual cancers. Otherwise, we should be talking about all cancers throughout the year.
Yes. Doctor, this is your field. How is cancer affected the local people?
Cancer is really a disease that a lot of people are very scared of. There is a lot of stigma associated with cancer, simply because people don't know much about it, and unfortunately, in our environment, the limited awareness also brings in a lot of fear, such that people are even scared of going to seek services for cancer diagnosis and treatment. And then, unfortunately, also, when the patients have been diagnosed with cancer, they always associate it with death, which actually makes it more difficult. And yet we have got people, a lot of people who have been cured of cancer and they are alive. Also, unfortunately, because of all these other factors, a lot of patients present with advanced stage disease. And it's actually cheaper and you get better success when you treat disease at an early stage compared to when you treat the disease at a more advanced stage. If I may highlight this a bit more, advanced disease means the disease has got more versions of the disease. So cancer is a disease where you get an abnormality at the level of the cell. The cell nuclear material or the genetic material is triggered such that it continues to multiply at an uncontrolled rate, producing more and more cells. And these cells squash tissues that are around, and then some of the cells break away and travel to areas far, either through the lymphatic system or through the blood system to spread to other parts of the body. And characteristically, cancers is a disease where the cells have got this ability to spread to other parts of the body. These parts of the body commonly are either the lungs or the bones or the liver. Those are the common areas that cancer can go to. This is why when someone presents with cancer, we need to actually know what type of a cancer it is. And we take some tissue from, if in this case we're talking about breast cancer, the most common way a breast cancer presents is through a lump. So we need to take tissue from the lump, which is then examined by a specialist called a pathologist, and a diagnosis of breast cancer is made. And then we need to then find out how far gone the disease is, and we call that staging of the disease. This way you are doing x-rays, specialized x-rays and blood tests, which can then tell you the extent of the tumor, which helps in planning the treatment of the patient. Once we then know what the cancer is, where it is, how far gone it is, the doctors sit together and plan the treatment. The treatments can either be removal of the lump and surrounding tissue or removal of the breast, depending on the extent of the disease. And then sometimes you may need extra treatment to make sure that you reduce the chance of the cancer coming back or reduce the chance of the cancer spreading. We are now trying to mop up what we cannot see with the usual tests, and then you can treat with chemotherapy, which is using anti-cancer medicines, and most of the time this can be given through the vein to travel to part of the body to actually attack the dividing cells. What gives rise to side effects of chemotherapy is the fact that it hits the dividing cells.
Okay.
And you have to schedule it such that you hit more of the cancer cells than the normal cells. The advantage is that the normal cells recover faster, whereas the cancer cells take longer to recover. So a typical chemotherapy schedule can be once every 3 weeks, and by then we are saying the normal cells have recovered. The patient should be normal. You don't want to hit the patient too hard because the normal cells are responsible for maintaining normal body functions, like the white blood cells are used for fighting infections. There are some other cells called platelets that we use for clotting. If you get injured, for your blood to clot, you need those. And then there are other cells like the red blood cells. They are the ones that carry the oxygen. And the most vulnerable of these are the white blood cells. So we give the chemotherapy when the levels are actually normal, so that when we hit the cells again, the patient can still remain with some cells. And there are times when we even tell the patient that we need to check your blood, say 10 days after the treatment, when we expect the normal cells to be at their lowest. And we are doing that so that there are ways of rescuing the white blood cells. We can give an injection to actually induce multiplication of the cells before the next chemotherapy, so that the patient will be having normal cells. So we've talked about chemotherapy. Another treatment that can also be used for breast cancer is hormonal treatment. And the most common hormonal treatment for breast cancer is a medication called tamoxifen. Tamoxifen works on the nucleus of the cell. It sort of like blocks the receptors. They're called receptors in the nucleus, estrogen receptors. Women have got more estrogens than males. So what happens is that estrogens that are in the body can actually fuel the growth of the cancers that are in the breast or anywhere in the body. So tamoxifen blocks these receptors so that you slow down or even prevent the growth of the cancer. And this can be used in someone who has had treatment and there's no sign of cancer, or in someone who has got cancer that has spread and you actually slow down the growth of the cancer. In fact, we are striving to get to a stage where some patients with advanced cancer can actually continue to live in spite of their cancers through these various treatments like tamoxifen or a lot of other new treatments. Just like a diabetic is given anti-diabetic medication, you're not curing them of their diabetes, but you are actually giving them treatment so that they continue to live. So in this case, we are looking at cancer becoming a chronic disease. And this is going to happen one of these days with all the research that is happening. So tamoxifen is hormone treatment that Cancer Safe, which is an organization that I chair, is a private voluntary organization that is actually, we found out that there are some patients, some of them from the rural areas, who are unable to access this medication because it's not always readily available. And as an organization, we say, since this medication is actually the most common medication that is used by cancer patients, because patients have to take it for at least 5 to 10 years to continuously suppress the cancer. And I mean, this is the most common medicine that is taken. So it means if it costs something like $20 US, you multiply that by 12 months and you multiply that by 5 years. For someone who does not have a salary, it may be very difficult for them to access this medication. So that's what we're working on as Cancer Safe. So we have managed to secure at least a year of medication, supply of medication for about 380 disadvantaged women. We are saying some people have actually committed themselves to this cause. We now need to have sustainability of this. And the best way for it to be sustainable is for us to get more people donating towards this cause or this project so that we can, 1, save more women, and 2, save them for a longer period. So I'm appealing to anyone who understands this cause to actually try and assist in whatever way they can.
Just a brief, I might have missed it. You said you have some medication for about 300 disadvantaged women. Is it they walk in and get that for free?
Yes, that's what we want to do. In fact, what we're trying to do is to partner with public institutions so that the medication is dispensed from the public institution. And we screen the people that are going to be receiving this medication to make sure that they are really disadvantaged women. And they are given this medication free of charge.
Okay. Thank you, Doctor. We are also joined by cancer survivor. If you could just introduce yourself.
Hello to all the viewers. My name is Keretia Chikowe. I'm a colon cancer survivor. I've been in remission for about 4 years now. Yes, I was diagnosed in 2017. And I went through the treatment through chemotherapy. It wasn't an easy journey, but I'm here today. And while I was recovering from cancer, I decided to start an organization to offer psychosocial support, because that's the thing that I realized was a gap within the management of cancer patients and support for their families and caregivers. Second Chance was launched in 2019 on the 2nd of November. And Dr. Nyakabau was one of the guests who was there to launch Second Chance. And since we launched Second Chance, we had an opportunity to go for an outreach program with Dr. Nyakabau and a team from Cancer Save to go and offer some of the services that we could offer. Our partnership with Cancer Save is such that we complement each other's efforts. Cancer Save being more of the technocrats, Second Chance offering psychosocial support, filling up the gaps. As you know, with Cancer Save, Doc, you also offer psychosocial support services, but their major thrust, like she said, they try to source medication for the less privileged so that everybody has an opportunity to get treatment despite their social status.
As a cancer survivor, what are some of the myths and misconceptions that makes cancer patients go to the hospital very, very late? You have gone through that, and you've also met some of these people when you offer social support.
There are so many reasons why people really don't seek early treatment. There are myths and misconceptions about cancer. Number one, people think that you are bewitched. Number two, they actually think that the moment you're diagnosed with cancer, you will be dead in a short time.
Oh, you thought you were bewitched?
I didn't think like that I was bewitched.
Yeah.
For me, fortunately, I'd worked in a few health institutions. Although I had not studied a lot about cancer, what I knew about cancer was that cancer is a disease that affects the cells, and they begin to multiply in a random way, which is not a pattern which they're supposed to. And I also knew that there are factors, risk factors, regarding, someone getting cancer. It could be hereditary, it could be the diet, it could be exposure to chemicals, and so on and so forth. It took me a bit of time to actually seek medical treatment.
Okay.
Robbie, people always say, you never understand until you get to the situation. It took me a bit of time, really a bit of time, to actually seek for medical help. But when I got the medical help, and Doc spoke about treatment plan, because each and every patient is different. Their makeup is different. So they always come up with a treatment plan. And when I was diagnosed, the physician quickly put up a team of doctors that I had to manage my treatment. And I'm happy to say the surgery went on well. And I went through my chemotherapy, and I managed to get into remission. I want to believe that I'm fully recovered. But as a cancer patient, as a cancer survivor, that's why we talk about survivorship. You continue to work towards survival. This is what we are doing. As Second Chance, we continue to give people hope after adversity, to say, fine, you've gone through cancer, you've had cancer, or you're still going through treatment, but life goes on. You can still work, you can still do other things, you can make yourself financially sound. It's not a death sentence. It's just like somebody's got hypertension or diabetes.
Yes. And when you talk to some of these women who are cancer patients, what are some of the challenges that they say they face?
Most women cancer patients, number one, they face stigma, especially when we look at cervical cancer. I'm sure Doc will agree with me. It's not something that you can talk about because of where the part of the body where it is. So the women face a lot of stigma, and with all cancers, people face stigma because when you get cancer, sometimes your hair will fall off, it begins to thin, your skin will change, your eyes will change because of the toxins that are produced by the tumors that will be in your body. You can actually get a misdiagnosis and people think that you're HIV positive when you've got cancer, just like diabetes. So women suffer a lot of that. In most cases, they can either be labeled to be loose. Why do you look like that? Yet somebody hasn't found out what has happened to the person. And then the other challenge that women face is of managing their households. You are doing chemotherapy, you're going through chemotherapy, or you have had breast cancer. October is breast cancer month. Your breast has been amputated. Medically, I'm sure Doc will confirm that. The moment your breast is taken out, whether it's the left or the right, it means the performance of the body has been compromised. People would still expect the woman to go kutsime, to do this and that, all those chores. Yet the body is under a lot of pressure. A second chance, we advocate for family members to understand that when someone is going through cancer, when somebody has been diagnosed with cancer, their immune system drastically falls. It drastically falls, and the muscles of their body, they get a lot of pressure from the intravenous treatment that the doctor was talking about. And then we also realize that statistically, most women are abandoned by their spouses when they fall sick. And even when you're going through chemotherapy, like in this pandemic, the COVID pandemic, you can still get COVID. And people expect you as a mother or as a wife or as a woman to continue saving. There's one person that Second Chance is offering psychosocial support. She's got an 8-year-old daughter. That's the oldest. She was on chemotherapy and she got COVID. And she was supposed to manage the home, and everybody in that home had COVID. But she was left to nurse all those people and give them care. It's more difficult for the women and girls by virtue of the societal expectations. Whereas if you, Robert, you get cancer and you are sick, I mean, you know it's given that your wife will be looking after you. Sometimes you don't even have to do anything. But for women, it's hard. We have another case which is in Mutare. This brings me to the point that is Second Chance. We also source for resources that are needed by people that are recovering from cancer, or that have survived, or that are still suffering from cancer. Currently, we have managed to get a Chikowe for a patient. We managed to mobilize resources to get some colostomy bags for a lady in Mutare. I saw her on social media, and she had surgery for colon cancer, and the wound was left open. She didn't have colostomy bags, and she was saying sometimes she gets infections. But when you look at it, the society around here could not really see that she has got a need. Why am I saying this? She also lost her husband. She's a widow now. The community actually stole from her the equipment that she was using for gardening. So it meant she has got no financial support at all, and she's got small children going to school. That's when Second Chance comes in to offer psychosocial support, give hope after and during adversity.
Dr. Nyakabau, why do cancer patients present late for medical services? is it because tinenge tichimbotraya zvimwe zvitozoona kuti aiwa zvaramba reka inofunga zvakuda chi ana mazvikokota ende masainzi nemasymptoms ati anoratidza kuti aiwa izvi kai zvida wakurumidza waenda kunana mazvikokota vaona kuti inenge cancer ukurumidze kurapwa. What are some of these?
Okay. Reasons for delay in presenting with cancer are actually many. They can be due to the patients themselves, they can be due to the health institutions and others. I mean, if you look at the patients and their families, sometimes awareness, even of the symptoms, people might not know that they could be harboring with cancer. So it will take them time before they realize. Sometimes maybe some symptoms, like maybe when they see blood, that's when they will then get alarmed and go and present. If they don't get that, they will just continue with their daily lives. And in our society, people might, let's say in our society, sometimes some women may want permission from the husband to go and attend to the health institutions. And sometimes the family might have to sit, and then resources, transport, resources, and sometimes some people may even, as a family, they may decide to go to alternative medical practitioners before they come to the mainstream medical system, and that may cause delay. It's not that they are, it's because they believe maybe that's where they should go, but in actual fact, if we raise awareness that it's important for them to present to the hospitals first so that a diagnosis is made and treatment is started early. And we're not saying that alternative treatment like even spiritual care should not be used, but they should be used to complement the mainstream medicine. And then when they have gone to the institution, sometimes depending on where they go first, also the people that they see must be able to make the diagnosis. And if maybe at the time where they go, at the place where they go, they are not really vexed with cancer, it may take longer for the diagnosis to be made. So there are so many areas where something can be a reason for delay, and that's why it's important that we can have what you call referral pathways in our system, and even patient navigating systems, so that at the earliest suspicion of symptoms, the patient is timeously referred to the appropriate places such that they eventually get the appropriate treatment that they need, so that we can be able to deal with the disease decisively before it is advanced.
As cancer says, what kind of assistance do you want from the corporate world and individual to lessen your burden as you try to deliver the mandate of Cancer Safe Association?
Thank you very much. I think awareness of cancer issues is very important. And actually, as Cancer Safe, we have decided that awareness of healthcare workers has got a higher impact if we focus on that. Because, there are so many players in terms of those who are working with cancer, such that we're saying, okay, whilst other organizations are increasing awareness to the patients or the society, we as Cancer Safe would really like to focus on awareness of healthcare workers, so that, when we actually see that healthcare workers know more about cancer, they can actually then, wherever they are, healthcare workers are all over the country, they can then also teach society, teach patients and their families about cancer, and then also practice such that early diagnosis and early treatment is instituted so that we can actually be able to control cancer better. So awareness to the healthcare workers is what Chemotherapy want to see happening. Funding to make sure that patients are assisted to be able to go and have their cancer biopsy, that is tissue, is removed and examined so that there is no delay, is something that in the long run we would like to see happening as well, because that will mean that patients can be treated better earlier.
And I would also want to pose the same question to Second Chance. What kind of assistance do you want in your mandate as you deliver psychosocial support to individuals out in the community?
Thank you very much, Robert. As Second Chance, we require funding to set up a center to offer psychosocial support. After the oncologist, the physician, the surgeon, the GP have seen the patient, because they are overwhelmed, they can then be referred to Second Chance and all other relevant organizations to come and get psychosocial support. We want a holistic approach, so what is required is enough funding to make sure that we can also empower cancer survivors, for them to move on by making sure that they get training for sustainability, to manage their businesses, and so that they can also go back into the mainstream of employment. There are courses that they can do, or during the season when they are on chemotherapy, for those who are stronger, because I remember I used to have a lot of muscle tremors soon after my chemotherapy. But there was a colleague that we used to sit close to each other, and she would come for chemo, and after chemo she would go back to work. It means that kind of a person can actually get life skills while she's on training, so that while she's on treatment, so that thereafter she can still be absorbed by the society and move on. And also funding to make sure that we reach out, especially to the least of our communities. I mean, we are talking about psychosocial support with Dr. Nyakabau here. A person in the rural areas doesn't even know that there's psychosocial support. Psychosocial support is just, most of the time is finding someone to talk to, being given hope, to say, maita cancer asimunurapika. That's the first port of call. Like what the doc said, it's not a death sentence. It can be treated. So we also would love to raise awareness, to do awareness campaigns, trainings, many other activities as we complement each other with Cancer Safe. Doc said their thrust is to train the healthcare professionals, and ours is to focus on the community, on the survivors and the people that are going through cancer, their caregivers, their families, and their communities. What I've realized is that with cancer, when I have cancer, my whole community is impacted, from my church to my neighbor, to my colleague at work, to my family, my immediate family. Everybody is affected. How do we handle this situation? Offer psychosocial support to heal people emotionally, psychologically, and emotionally, while the doctors do the physical healing. I'll give you an example. When we had an outreach with Cancer Save in Karanda about a year ago. When we got there, these doctors, when they get to a place that they want to treat people, Robert, Dr. Nyakabau was no longer our friend. As soon as we disembarked from the bus, straight away she went into the wards. She needed to make sure that with the other colleagues, other doctors that we had gone with, they wanted to make sure that they maximize with the time that they had to treat as many people as possible. Our site was set up on the side, offering psychosocial support, counseling people, because there were quite a number of us. We had gone through cancer, we had survived cancer. And this complementary role of different organizations, it helps us to manage issues that relate to cancer and all other health conditions that are challenging in our communities. Therefore, I would want to say Second Chance is seeking for funders. Like I would want to reiterate the fact that we also offer other services in kind, mobilizing resources like Comodays. Doc knows that someone has got breast cancer. It will move and go to the back, and that person ends up not even moving. So we do, for example, currently we have what we call a diaper drive, where we are requesting the public to donate adult diapers. Because when someone falls sick, initially they will be able to be getting around, but eventually, especially the last days, the person is bedridden, they can't use the toilet, so we need what are called Comodays. We need those medical beds, dogs, so that when they are released to go home, there's one particular person that Second Chance is working with currently. She was complaining that she feels very dizzy because she spends the whole day sleeping without being elevated. Whereas when you're in hospital, there are those elevating beds. So if we can get donations for elevated bed, for medical beds, that would then say if a patient has been discharged by the oncologist to say, we are done with chemotherapy, you can go and recuperate from home. Those who offer palliative care, they offer palliative care. They are comfortable, they have a bed, they have a commode, they have diapers, they have colostomy bags, they've got walking frames. It makes life easier for the caregiver.
Mm-hmm. And what kind of advice would you give a woman or family members that are watching right now who has a cancer patient at home? Some of them, the patient or the family members, have lost hope. They're just saying, Tamirira,
my advice is cancer is not a death sentence. Like any other disease, you'll be surprised. Dr. Nyakabau always gets surprises where a patient comes, probably even at stage 4, doc, but that person will survive and even surpass someone who didn't even have cancer in terms of the years that they survive. There's power in a positive mind in all the people, the patient, the caregivers, the family, the community. Be positive and understand that cancer is treatable. Practice good health-seeking behaviors. Doc spoke about the fact that patients come when they've already presented with blood, when they see blood. I'm one of the culprits. By the time I went to the doctor, I could see blood, but I had not been well for a long time. So let's seek medical help as quickly as possible. When you don't have funds to get treated, it's not a sign of weakness to ask others to help you. That typical example I gave of a woman in Mutare, Sister Agnes took the colostomy bags for her to Mutare. Just yesterday I delivered them at the convent there. She went to the public and said, I don't have colostomy bags. If you don't have, there's nothing wrong in asking. And Cancer Save and the Second Chance alike, we are for looking for donations from people that can donate to the public. The other point is that it is of paramount importance to understand the treatment of cancer. Myths and misconceptions. Ukapiswa unofa. Hapana panombopiswa munhu. Doc explained that they treat you intravenously. Let's not scare each other. When it comes to the use of alternative medicines, I would encourage people to go to get the conventional treatment first. And if you have to take anything else, let it be complementary, or you take it in form of food. Let's remember that plants are medicines. It's either you take plants as medicines, or you will be treated by them in another form, which might actually have side effects. Critically, let's watch our diets. Red meat will kill you. Fatty foods will kill you. Let's change our diets. And when we have someone who is sick at home, let's remember that this person is already stressed. Let's give them love, compassion, and care.
Dr. Nyakabau, what are some of the questions that cancer patients that for the first time visit the surgery ask?
Thank you very much. Patients usually want to know about the disease. So we always try as much as possible to unpack cancer to their level so that they can understand. Once they understand the disease, then when we talk to them about the treatment, it becomes easier for them to comply with the treatment, because then they will be knowing the reasons why they have to take the medication. Yes, the treatments are new treatments to them when they come to us as oncologists. Some of them might not have had anyone who has been through similar treatments, and they would have had all sorts of information from the next door neighbors about the treatment, such that they will be told, things like that. So we have to sit them down and calm them down and actually explain. A lot of times they will be told, don't get radiotherapy because it will burn you. Radiotherapy is X-ray treatment, which is given to actually kill the cells that may be in the area or the base of the tumor or the tumor itself, and it works through actually destroying the multiplying ability of the cells. The difference between radiotherapy and chemotherapy is that radiotherapy works locally, just like an operation or a surgery, whereas chemotherapy, the medication goes throughout the body. That's why it's not selective in terms of the side effects. Whereas when you give radiotherapy, the effects are just localized to the area. Like if you're giving radiotherapy to the breast, you're giving it to the area of the breast and the surrounding tissue. And the side effects come through the fact that, when you're giving the treatment, you're shooting from different angles. And the kind of directing the beam of X-rays is like the way you direct, when you're shooting, even like in the wall. And, the bullet will not choose that this is normal tissue, this is abnormal tissue. So, unfortunately, you can't see radiation. It is not visible. But when the patients get treated, later on you see the effects of radiation. And some of the effects may look like a burn because the tissues will become like discolored. And maybe when the side effects are a bit more, you can get like a burn. And that's where the name Upiswa comes from. It's just that the effects may be like a burn. And usually it's just a short-lived side effect, which when it's managed appropriately, the patient will actually get better, and that there will be healing, total healing, maybe except for a bit of residual discoloration, but the patient will end up being normal. In fact, some of the patients who have had radiotherapy, you can hardly see that they had. You won't know which area was given radiotherapy because they will have healed nicely. So those are some of the problems that we actually meet with our patients. And also one other thing is also the way the news is broken to the patient can actually make or break the patient. This is why we also want a trust to actually see if we can be able to train healthcare workers to give bad news in a way that actually does not make cancer so frightening. So when we increase the awareness, the patient is aware, the healthcare worker is aware, the news is not going to be that disheartening, and someone will be able to get their treatments and accept it much better if that is the case. I mean, I do have vivid cases of some patients who, when they, because bad news is not just about the disease, it's also about the treatment itself. If you have told the patient that, you have got this disease, and then the next thing is that we are going to remove your leg, it's also bad news because the patient is like shattered to say, now how am I going to walk? So all these things are things that can actually affect the patients and their families. And then even the fact that when they find out that, the treatment is costly, and there are times when the out-of-pocket payment is a little bit heavy on them, that's also bad news, because you may find that some people may even want to sell their houses to be able to pay for the treatment. And it's important that we navigate with the patients to see how best they can be assisted so that they don't make rushed decisions that may have consequences that make life so difficult for them after they have had their treatment. A lot of the decisions will actually be emotional. You say, okay, we have just had this diagnosis, we need to have this treatment, and they will sell everything that they have. And then when the patient has been cured of the cancer, they are now going to have to start afresh. So it's important that we have second chance to be able to offer psychosocial support and also see where the patients can be helped so that the impact of the diagnosis, the impact of the disease is not too much on the patient and their families. And when she talked about the fact that we need somewhere for psychosocial support, I think my dream is that we have a one-stop hospital for the cancer patients where they can have everything done for them without them having to go to another place. You can imagine, they go to this place for the biopsy, they go to this place for an X-ray, they go to this place to buy the chemotherapy, they go to this place for radiotherapy. It's very draining for the people. And one day, hopefully, it will happen that everything will be under one roof. I've been to one place outside the country where there is a breast cancer center, where there is actually the biopsy places, doctors, different doctors, physiotherapists, radiotherapy machines, even shopping, appropriate shopping, mastectomy bras, all under the same roof. And I said to myself, wow, I think, when you see these things happening elsewhere, we are capable of doing that. Nothing is impossible. And one day, hopefully in my lifetime, I will see that happening.
And definitely you will see that happening. As we conclude, second chance, what is your message to someone who is watching right now during this October month?
October month is breast cancer month. A second chance, we encourage women to do what is called personal breast check on a monthly basis. And if they notice that they have a problem, they should sort counseling. They can even call us on 0773 375 029. We counsel them. We offer psychosocial support. And for everything that is medical about the way they will be feeling, they should seek help from the medical personnel, the doctors, or go to the nearest clinic, at least go to the nearest clinic. And it is of paramount importance to watch your diet, exercise, good sleep, rest, continue with a positive mind all the time.
Probably if you could give them your contact details again.
Our contact details, you can get us on 0773 375 029. That's our phone number. And we also have an Instagram page and a Facebook page where they can also react to the posts that we put up or contribute anything that they would want to contribute or ask questions. Then we'll respond to them.